reports. The chair now recognizes the chairman of the full committee, Chairman Guthrie, for 5 minutes of questioning.
Thank you, Mr. Secretary. Over here on this end. So we talked about the reduction in force. So I'm going to ask you, I'll do 3 questions quick and let you answer. So what is the status of the reduction in force or any potential reorganization? And are you able to discuss the details of this potential action, or does the legal situation limit what you're able to do today? And then what does the path forward look like if the injunction's cleared?
With that issue now, the reduction in force are under litigation. And we're under a court order not to talk about them.
So if the injunction's lifted, the path forward, or can you talk about that as well? So what would happen if the path forward if the injunction is lifted?
What happened with?
If the injunction is lifted,
what
would the path forward look like?
If the injunction is lifted, Congressman, what was the rest of your question?
What would the path forward look like? The path forward.
Well,
what do you see HHS becoming if the injunction is lifted with the reduction in force in place?
The people who are subject to the injunction force are on administrative leave, and they will remain on administrative leave until the injunction is lifted. At that point, we will make decisions, and in some cases, there have been gaps in our ability to perform our duties. I've brought people back. I've brought 722 people back to CDC. I brought 220 people back to NIH because we were not able to perform our job. And I brought 313 people back to NIOSH for the World Trade Center, for the Cleveland office, and the Morgantown office. They were doing important work that we did not, that was critical. But the people who have been terminated are people who are involved in administration. There are tremendous redundancies in my department, and I'll just give you a couple of examples of that. We had 9 separate offices for women's health. We had 8 separate offices for minority health. We had 41 chief information officers. We have 1,400 external affairs staff, 40 procurement departments using 4 different contracting systems, 9 human resource departments, 8 finance departments, 40 separate opioid programs, 42 maternal health programs. And so what we tried to do is consolidate those, and the people who were let go were people who were not involved in primary care or in delivery of care. They were redundant administrative offices that have been added to over the past 8 years, and where we've increased staff by 17%. And we were going back to the pre-Biden era levels, and that's what the RIFs are intended to do.
So, and as you saw gaps in some of those decisions, you brought people back to fill the gaps, to complete the mission that you want HHS to do. So so thanks for doing that. So one other question, I only have about a minute and a half left, but one of my biggest priorities over time has been innovation. We talked about Boston and what's going on there with type 1 and Alzheimer's and others. President Trump finalized the Medicare coverage of an innovative technology rule just before the end of his first term. President Biden modified the MCIT rule, but significantly restricted access to the program. And by extension, President Biden's administration restricted access to breakthrough technology. Will CMS modify the Biden administration's policy? And do you have a timeline from when we can expect modifications on MCIT?
We're doing more than probably any other cabinet department to drive AI and new technologies into the healthcare system, into our department. We're using it in every aspect of our health department. You saw my press conference yesterday with Chris Klum. He's a billionaire who's walked away from a billion-dollar business in Silicon Valley to come and revolutionize AI in our department. We're doing that at every level of our department. We have the best people in the world working for us, and we're going to transform the American health system over the next 4 years and make it the leading health system in the world because of the technology that we're bringing in. And we have the best people working for us. We've been able to recruit and attract people of unprecedented caliber to our agency to facilitate that transformation. And it's one of the things that I'm most excited about.
Thank you. Well, my time just expired, and I appreciate you being here. I'll yield back.
The gentleman yields. The chair now